Hey everyone, Mo checking in. I am 6 or 7 days post-op. I have my check-in tomorrow with Dr. Rafael up in Plano, Texas, so I'll keep you guys updated on that. But I just wanted to give you guys a quick showing of my chest being like 6 days post-op or something like that. And I also wanted to keep to my promise about making a video about financing surgery. So first, I guess I'll show you guys my chest. I obviously have like my bandages and like my girdle thing off right now. But this is where I'm at right now. Sorry for the lighting. I don't know how good the lighting is. I feel really small because like I just haven't been able to work out. So I feel like my shoulders and my arms look just puny. But believe it or not, like a lot of the swelling has gone down. So I'm hoping that a lot of this, sorry that light back there is like not helping. But I'm hoping that like a lot of this is muscle. And as you can see close up, incisions look pretty good. You know, they go pretty far back. But they look, nice and even, I'd say. And I think that they're at like a good level. I don't want to like flex my pec or anything, but I think they're pretty close to the bottom of the pec line. So financing. So first off, let me say, I'm in like no way, like I don't know, I didn't even like study economics or like finance, personal finance or anything like that. So I'm in like no way an expert. I don't work at a bank. I'm not affiliated with anything like that. But I guess I'll tell you guys what I did. And if you watched my video, I think it was like 5 months on T, I shared like my plan for how I was going to finance surgery, and I even said how it may or may not be the best idea, but this is what I'm going to do because I just like need top surgery or really want to get it done. And what I essentially did as a student still, a graduate student, I qualify, I should say, for like financial aid. Now, when you're a grad student, it's like all loans, essentially. Like, unlike the Pell Grant or whatever that I got, like, as an undergrad. So, I used, knowing that I'm pretty much finished with my master's, minus, like, a couple hours, I knew that if I extended my schooling by a semester, or potentially two, I could take out another year of financial aid and use some of that, not all of it, to, like, help me get over that hump when it came to like saving for surgery and getting it done. Now, you think to yourself, Mo, that's a loan. Like you still have to pay it back. What's the difference between getting like a regular bank loan or something else? Well, I could be wrong, but as you guys know, if you're students or if you've dealt with this, student loans, fortunately, you don't have to pay them back right away. Yes, interest is a thing, but they do tend to be low interest relative to like getting a loan at some kind of like shady place or, something like that. A relatively low interest rate. And I personally, as someone who's going to be a student for the next few years as I continue with my PhD, am not going to be responsible for that loan for a while. Now, that doesn't mean that I won't start paying on it early, especially to start paying off the interest, 'cause that's like the smart thing to do. AKA, it wasn't like a bank loan that would like require me to pay back freaking like $5,000 in 90 days or something like that. You know what I mean? So that's the reason why I stuck with it. And also, it wasn't money that I was like gonna miss. Like I didn't cheat myself on classes or anything like that. Like I'm in the classes I need to be in. I have enough money to still live and pay my rent and buy my textbooks. It was money that I wasn't really gonna miss. And also for me, I realized that as a 24-year-old, even though that lump sum of money is not mine, and most of it is to go toward my education, it was the only time in my life, unless I fucking win the lottery soon, that I was gonna come upon a large sum of cash. Like I said, unless I won the lottery or something like that, even though it was a loan, I probably couldn't have gotten a bank loan for someone as young as I am with young credit, from my bank. So the student loan way for me was the option that I took. I do not regret it. And once again, I will say I did not finance my entire surgery cost with that. I used a combination of care credits, which I'll talk about in a minute, the student loan, and just cash that I had saved over time. So I really tried to use, of course, the least amount of credit possible. I tried to pay as much cash as possible to not put the burden on paying back those loans. The other thing is care credit. So care credit, as you guys probably have heard of, it's like a credit card, but it's like for medical expenses only. And this is like available at a lot of places. So even for you guys not considering top surgery or maybe have some other medical thing that you need to address, you could always apply for Care Credit and use that to pay for your medical bills, just an FYI. So Care Credit it's like I said, just a credit card you apply for. You can either get rejected or accepted, and there's a credit limit that they put on it. I was able to get a $6,000 limit. No, I did not use all $6,000 on credit because I really tried to use as much cash as I could, but it was an option. But that's all I can really say about Care Credit because every doctor is different. Like, for example, Dr. Rafael, and don't hold me to this, like, it's for some reason, it's not the credit card company, it's like the doctor's offices who like decide what payment plans are available to you. It's almost like the credit card company doesn't care, they just want their money. So Dr. Rafael offered 6 months, 0 interest. If you pay it all back in 6 months, there's no interest. Or something along the lines of like 12 or 24 months to pay it back, but which is way more time, obviously, but the interest rate, as you guys know, is ridiculous. It was like 14.9% or something. So I, of course, chose the 6 months, 0 interest. You have to see what he offers or what your surgeon offers. But yeah. So once again, to cover cash of my own, Care Credit, and a little bit of a student loan. By the way, I don't mind prolonging my schooling a little bit, I should say that, because I'm actually working on my thesis now as a master's student. And for any of you who have worked on your master's or your thesis or a thesis, like an undergraduate thesis, you know that there's no rushing that. So it actually, for the sake of getting top surgery, being in relatively close proximity to Dr. Raphael, getting top surgery soon, and, just so many other factors made prolonging school for like an extra semester or two, even though I won't even be taking a full course load. I'll mostly just be doing my thesis experience. That doesn't bother me at all. Like, this is the result I got. Like, I can fucking spend another, couple months. Technically, like, I could have graduated with the rest of my cohort in May, but like, I will gladly spend an extra couple months on this program to have gotten top surgery. Like, I don't have any regrets thus far. But last thing I want to say, sorry this video is getting kind of long, is that, like, I'm speaking from a place of privilege here because I fortunately have really good credit. I mean, I won't say exactly what it is, but it's quite good for my age. And that is because I bought a car when I was